Dạ, cảm ơn phần trình bày hết sức thú vị của bác sĩ chuyên khoa 2 Trần Duy Tân đến từ Bệnh viện Tâm thần Thành phố Hồ Chí Minh. Do thời gian không còn nữa, cảm ơn các quý vị đồng nghiệp nào có câu hỏi xin gửi trực tiếp cho các báo cáo viên. Tôi đại diện cho chủ tọa đoàn kết thúc cái phiên này để dành thời gian còn lại cho các phiên tiếp theo. Xin cảm ơn.
Mạnh được rồi. Ok. Rồi, you can
Dear Professor, could we start?
Nghe rõ đấy. Bắt đầu đi sir.
Dear Professor and the entire conference, welcome to Young Investigator Award. Would you like to introduce the members of examiner? First, Professor Huỳnh Văn Minh, Associate Professor Nguyễn Anh Vũ, Associate Professor Hoàng Anh Tiến, Doctor of Philosophy Nguyễn Thị Diễm, Specialist Level 2 Lê Tân Tố Anh, Doctor of Philosophy Trần Kim Sơn, and six reporters present here. Now we have six topics in this session. First, we need to know some things. Each of your reporter is 10 minutes maximum. After that, we will ask some questions, and reporters will answer questions from 3 to 5 minutes. Now, opening with the report, the topic is the important role of temporary pacemaker in the complete atrioventricular block due to diphtheria by Dr. Trương Hoài Nam from Gia Lai General Hospital. Now, opening with the report, the topic is the important role of temporary pacemaker in the complete atrioventricular block due to diphtheria by Dr. Trương Hoài Nam from Gia Lai General Hospital.
Diphtheria antidote, and the last is the optimal ACE inhibitor in the myocardial treatment. The prevalence of children of less 15 years old and the subjects are not immune due to not being fully injected with the vaccine. The rate of the death is usually due to airway obstruction and myocarditis. The report at 60 to 66% occurrence of myocarditis. Prevention diphtheria is effective thanks to vaccine. Diphtheria has still existed in Highlands, Vietnam, where 49 cases of birth occurred in 2020 in Gia Lai province with a 2 cases of death. The case report, the 21 years old male patient were hospitalized with of the fever and sore throat about 1 week before. The symptom is a difficult swallowing, increased sore throat, difficult speaking, throat with wide pseudomembranous. Patients were transferred to Gia Lai Province Hospital. Examination with blood pressure is 100 over the 60 millimeter of mercury. The heart rate 101 beat per minute. The temperature is 38.5 degrees with the left tonsil swollen, throat with wide pseudomembranous. In this picture beside, no difficult breathing, no chest pain. The history of vaccination is unknown. The workup with ECG with the synerism and the chest X-ray is still normal. The real-time PCR positive with diphtheria. With treatment with nutrition through the nasogastric tube, the penicillin G, the SAD, the first dose after the 10 days of the onset of disease, methylprednisolone 40 milligrams 2 times per day IV. After the 3 days of treatment, the patient becomes fatigued, difficulty breathing, difficulty swallowing, less urination, blood pressure is 90 over the 60 millimeter of mercury, heart rate is 60 beats per minute, the troponin I 1.158 nanogram per milliliter, and PNP is 697 nanogram per milliliter. The ECG showed the third AV block. The diagnosis is the third AV block and myocarditis due to diphtheria. The patient were implanted temporary pacemaker on the femoral vein by ultrasound directly after the ECG change. The temporary pacemaker with the sensing the 1.25 millivolt output 3 millivolt heart rate is 60 beats per minute. The additional medication is a captopril 25 milligram 2 times per day. The echocardiography will show the lab function in these three with the F bar Simpson is 31%. 10 days after temporary pacemaker insertion, the mode is standard heart rate is 60 beats per minute. So the EKG show the patient with intrinsic rhythm and the PVC QRS become narrowed. When we off the pacemaker, we can see the sinus pulse on the ECG design. After the 3 weeks in the mode standard, the EKG show the BAV1 and left bundle branch block. After a total of 5 weeks on the pacing temporary pacemaker as standby, the sinus rhythm is narrow QRS without spine of the temporary pacemaker. The echocardiography with the left ventricular systolic good function. The normal heart on the chest is straight. The patient were discharged with a totally of the 6 weeks out of the hospital. A temporary pacemaker placement in the patient with diphtheria induced myocarditis has been studied. The temporary cardiac pacemaker was associated with a reduction in the mortality rate to 74% in some study. Indication for placing a temporary pacemaker you just saw guidance were widely accepted with a very mobile, flexible, and suitable in the situation of the infectious disease when the DSA system is not already. So this clip how to we place on a temporary pacemaker on ultrasound. We can show very slow heart rate. We steer in the lid into the right atrium, and when we approach the tricuspid valve and we slightly push into the right ventricle, difficulty to when we approach the tricuspid valve, and after we pass off the tricuspid valve, the lids are approach with the ventricular, right ventricular, and the heart rate is faster. And the rate of procedure like vessel trauma, difficulty traveling in the tricuspid valve, the trauma of the tricuspid left lip, the ventricular perforation. Actually, when we guided with ultrasound, we cannot see clearly how to steer in the leak. And this is the reason why we take a risk when we do procedure. But in the situation of the medical facility with the lack of equipment, the DSA system we don't have, and the room to prevent transmission. Actually now we have to wear the PPE and the face shield when it's not clearly the vision is not clearly. We cannot see clearly when we do procedure. The role of the diphtheria antitoxin. The antitoxin is proven in value in the early stage. The efficacy of the corticosteroid therapy for prevention of the diphtheritic myocarditis was studied. Actually, it's not. Steroid is not to prevent the occurrence of myocarditis. So about the ACE inhibitor and ARB inhibitor. Due to the early use of ACE inhibitor, it reduces myocardial reconstruction and slows the progression of the dilated cardiomyopathy. Based on the experimental evidence in the viral myocarditis, the use of the captopril or losartan significantly reduces inflammation, necrosis, and fibrosis of the heart. This is demonstrated in some study. So, moreover, all given of the antibiotic prophylaxis with the azithromycin 500 milligram once daily or erythromycin 500 milligram 2 times a day for the duration of contact to prevent when we take care of the patient. The conclusion is the diphtheria is a serious disease, the high mortality rate, a communicable disease, and based on vaccine efficacy in the community to so slow incident. Although the disease is still endemic in the Jalai, the most diphtheria that are due to the toxic infections, infections and cardiovascular complications. Early treatment with the diphtheria antitoxin have significantly reduced the complication. A temporary pacemaker injection uses sound guidance, which is very immobile, flexible, and suitable in the situation of the infectious disease when the DSA system is not already. Optimization of the ACE inhibitor improves myocardial function and reduces remodeling. Azithromycin 0.5 gram once daily or erythromycin 0.5 gram 2 times a day to prevent infection when we expose with the disease. Thanks for attention.